Hello, my name is Caleb Smith with the Rocket Miner newspaper, here with an update for March 24th, 2021, where we're pretty much just going to be talking about health-related stuff, such as the question of where funding for the ambulance services will come from in Sweetwater County, the Wyoming legislature's efforts to revise how statewide health orders are administered, and a quick check-in at the national level to see how coronavirus vaccination efforts are going. Beginning close to home, the Sweetwater County Commission today announced in a special meeting that it will continue to fully fund the ambulance service subsidy through the current fiscal year. Back in December, it announced that it intended to cease its contracts with the Castle Rock Hospital District and Sweetwater Medics, LLC, citing a decline in revenue and other priorities that are mandated that the Commission prioritize when it comes to the services it provides. Following that announcement, there were quite a bit of outreach efforts from at the county level, its entities, and the cities of Rock Springs and Green River about what can be done to continue a service that anybody who's talked on the issue stressed that this is a vital service that needs to continue. We count on it. We don't know what we would do without it. Last week, the Rock Springs City Council directed Mayor Tim Como to draft a letter to the Commission, which was read at today's meeting, stating the desire for more time to kind of better digest the situation, saying that, or asking that the Commission continue to fully fund the subsidy through the current fiscal year, and that with that additional time, they were hopeful that they'd have a better idea about what the fiscal outlook of the city would be, and possibly some other changes to reorganize and continue this service. Commissioner Randy Wendley said he'd had similar discussions with the leadership in Green River, such as Mayor Pete Rust, and that's exactly what the Commission voted to do today in a 4-0 vote. They are going to continue to fund the ambulance subsidy. And they stress that it's not just a temporary extension. Come the new fiscal year, which kicks in July 1st, they still believe that the subsidy will continue. But the hope is that with the extra time created by this good faith effort, that the stakeholders will continue negotiations and discussions and be working toward a new system that funds it a little bit differently than it has in the past, probably sourced from a few places it wasn't before, and maybe some other organizational tweaks to continue the service, hopefully in a more sustainable, better organized way. At the state level, the Wyoming House of Representatives gave final approval to a bill that would alter the process through which public health orders are issued in the state. It's going to go to the Senate, and if the Senate passes it, and then there's a process that if both sides agree to the draft, it goes to the governors. House Bill 127 passed by an overwhelming 58-2 vote, and it would limit the initial lifespan of any order issued by a local or state health officer that would restrict individuals' movements or their ability to engage in an activity to 10 days without further approval for a corresponding elected body. For example, statewide orders, a decision on whether or not to extend the order would be left to the governor. And that would be as opposed to the Wyoming legislature, which has been proposed in some other bills. I believe it's Senate File 80 is one that would require an extension of its statewide order by Wyoming lawmakers after 60 days. That passed the Senate, it's waiting consideration in the House. House Speaker Eric Barlow, talking about House Bill 127, the one that we mentioned at the top, said that his bill aims to separate political decisions from those that should be left to health officials. There's been some criticism of these efforts. There are those such as Dr. Jean Station, Sweetwater County health officer, said that she was because of the way that the system that's in place right now, where she's not an elected official, but she's an expert. she was able to make decisions and not have to worry about the popularity of stuff. It has been noted that politicians don't always, sometimes, but not always, have a mixed reputation when it comes to making hard decisions that are unpopular but are the right thing to do, versus those who sometimes choose to preserve their own power, influence, position. We're certainly going to keep an eye on what the legislature does in this case. And then, just to wrap up at the end, the Centers for Disease Control and Prevention say that now 70% of the American population over the age of 65 have gotten at least one dose of the population. This was announced on a day where COVID-19 deaths dipped below 1,000 a day on average for the first time since November. The Associated Press notes that dozens of states, such as Wyoming, have opened vaccinations to all adults or are planning to do so in a matter of weeks. When it comes to being fully vaccinated, more than 43% of Americans 65 and older, which is said to be the most vulnerable age group, and accounting for an outsized share of the nation's more than 540,000 confirmed coronavirus deaths, have been fully vaccinated. The national health officials say that the number of older adults showing up in emergency rooms with COVID-19 is down significantly, as vaccinations overall have ramped up to 2.5 million to 3 million shots per day. Earlier this week, we noted how Sweetwater County officials stressed that now is the time to get vaccinations while doses are still readily available, and they're still hosting some of the larger clinics. They anticipate that those are going to kind of wrap up. A lot of people have kind of already gotten their first dose, and in some cases they're now just waiting on their second. Doses are also available through other sources such as Walmart or Smith's. The latter coming up in a recent expansion of the statewide vaccination efforts. The idea is that if you're interested in getting a vaccine, local officials say that they want to work with you to make sure that you get it. It's never fun getting a shot. I mean, I don't like having holes poked in me, but considering the greater good that it does for me, people around me that I care for, and the community, try to do what I can, and encouraging others to do the same. Anyway, this is Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow.